we all know knee pain is no fun, and it can significantly impact your quality of life from just getting around to even disrupting your sleep. Dr. Adam Rothenberg, orthopedic surgeon at Evergreen Health Orthopedic and Sports Care, joins me now to discuss when it may be time to get a knee replacement. Thank you for being here.
Thanks for having me.
So first, let's talk about when we know, okay, this is definitely time I need to go in.
Yeah, absolutely. Every patient has a different threshold for wanting to proceed with a knee replacement, but it's usually a combination of pain that they experience on a daily basis or a weekly basis, a loss of function. Maybe they can't hike the way they want to, or they don't want to go to the gym because it hurts too much, or just want to play with their grandkids and it hurts to get up and off the floor, or chase and play tag. And so that prompts them to be evaluated. If they have significant arthritis in the knee, then we often recommend knee replacement at that time.
Okay, I know my dad has had both of his knees done and totally changed his quality of life, so I can definitely attest to what you just said there. What is the muscle and tendon sparing technique for knee replacement, and how is that different than a traditional knee replacement?
Thanks for asking. I actually brought a little model here to show you, and I think we have got maybe a picture I can share as well. But traditionally, knee replacements, and most knee replacements still done, cut across the tendon into the muscle, and you see that this muscle then gets cut into. The risk with this is that when we repair the muscle side to side, that it doesn't heal properly, and so patients have trouble, they have more pain, they may not have as much strength. And so the muscle sparing technique is actually using a window between the critical ligaments here, this is called the medial collateral ligament, and the patellar tendon, and working between those underneath the muscle and bringing the muscle over. I do have another prop to show, and what we have to do a knee replacement is actually move tissues around to create a window to place these implants to put a new resurfacing in the knee replacement. And so the traditional approach allows for us to really get over and see things, but the downside or the cost is that it does damage muscle, and then that's a sacrifice for the patient. So by using specialized techniques and methods, including robotic technology, we work around that muscle belly, and we're able to do the same quality work without the pain and injury to the muscle here.
Gosh, okay. And you mentioned robotics, so how does that come into play then?
Absolutely. Like I said, when we bring that tendon over to try to do the work, the downside traditionally has been we can't really see as well to place the implants or to do the work that we need to make sure that the knee replacement works great for that patient and is in the proper alignment. Now with robotics, we can kind of see around a curve and still protect the nerves, the tendons, the ligaments, blood vessels to make sure the patient's safe, and then respect the muscle planes. What we've seen with the combination of robotic technology and muscle saving approaches has allowed our patients to have quicker recoveries, less pain, and a better functional outcome.
That's what I want to talk about with the recovery, of the benefit, of both of these techniques and why you would want to go with this new way instead of the traditional way.
Yeah, total knee replacement really has changed people's lives. Like you said, your dad's life was changed over the long term.
Absolutely.
But what patients really struggle with are those first few days and weeks that really make it hard, and they almost don't want to pull the trigger on that second time around because they remember how hard it was. So our goal at Evergreen Health, and my goal as a surgeon, is to make that experience much easier. So these are two tools in our quiver, I would say, to make sure that the early experience of less pain, quicker recovery, more independence early on is achieved by the patient.
Definitely. And you were touching on this, but how do you determine, obviously it's all about the patient, but having them come in and know what technique and just how that process is going to be? I assume it's a lot of putting them at ease.
Yeah, I think every patient is different. I would say most patients now are eligible for this type of procedure, so you can't really determine that on your own. But patients who have a large bit of deformity, maybe their knee is angled in a certain way, it's been operated on a number of times, there's damage from maybe a major trauma, those patients likely would need a different approach and maybe different implants. And we do have the ability to adapt to each patient's needs across the spectrum. So we just explain to them kind of the spectrum of how we do the approach and what implants we use, and we make sure we adapt it to each patient so they get the best outcome.
And what can people expect when they come in for a surgery like that? Like how long typically, or does it really differ from person to person?
The procedure itself, well, in general, takes under 2 hours for everything from start to finish, and that's for most patients. There's even the more complex ones might take a few, maybe 10 or 15 minutes longer. So we really try to plan and execute this procedure in a way that's really we can replicate. And then recovery is really what people care about more than the time they're under anesthesia. And that I would say, usually by 6 weeks, our patients are up and doing most every activity that they want to do around the house, around the home, with their families. They're independent, and hopefully we're getting them back to a higher level activity a few months down the road from there.
Absolutely. Well, thank you so much. We loved the props, we loved the information, and thanks for being here.
Thanks for having me.
And if you're experiencing knee pain and want to explore joint replacement surgery at Evergreen Health, please just visit the website that you see right there on your screen.
This portion of New Day Northwest is sponsored by Evergreen Health.